Hi everyone, it's me, Dr. Whimsy, and today we are talking about menopause and digestive health. These are the conversation I'm going to have with you today is about how our digestion can change as we age, particularly if you're perimenopausal or menopausal. There are a couple of reasons for that. We now know that part of the aging process can sometimes be poor pancreatic function. The pancreatic function can decline as we age, but we also know that fluctuations in hormones can also lead to digestive upsets of various different types. It's a drag, but luckily for me, I practice naturopathic medicine and I'm here to help. So I decided to focus on the three top digestive challenges of women who are perimenopausal and menopausal, and some of the ways that I treat it in my office. As some of the people who watch this channel know, I'm a naturopathic doctor. I focus on healthy to 40, 50, 60 and beyond, and I'm located in the Los Angeles area if you'd like to come in and talk to me. But today I want to just focus on those three worst symptoms, the three worst digestive symptoms that I see in my menopausal patients, how I break down what the cause of those symptoms could be, and how I treat it. So let's get started. The number one challenge, absolutely, that I see in my patients who are perimenopausal and menopausal is gas and bloating. This is the woman that comes to my office and she says that every time she eats something, her stomach swells up, or she has a gas, or she feels that just full very, very quickly. So when you get a symptom like that and you're a doctor, you have to rule out any kind of possible infection. Definitely is something that's on the list. Doctors will try and find out if they're looking at an H. pylori infection, for example. H. pylori is the bacteria that we now know is responsible for many times that people get stomach ulcers. Parasites can also cause gas and bloating, upset stomach. Allergies to certain foods, or sensitivities, when you're sensitive or you have difficulty digesting a particular food, you can sometimes get an upset stomach as well. So there are a lot of reasons why people get gas and bloating. Parasites are something that you want to rule out, particularly in patients who've been traveling. I do have quite a large percentage of my patients who travel extensively, not just in the United States, but in some areas of the world where they might be subjected to things like parasites. Candida or yeast overgrowth is something people have asked me about, what we also call dysbiosis, where you might have a lot of yeast in the digestive tract, but not a lot of what we call the good probiotics, the good bacteria that help us maintain good digestive health. All those things have to be looked at in a patient with gas and bloating. That means running some basic labs. You can do a breath test. That's where we have you breathe and into a machine, and they will detect whether or not you have an H. pylori infection. They'll do an H. pylori breath test. Other things they can do is they can do stool tests to look for candida overgrowth to find out if that's the challenge. You can also do what's called an O and P times 3 ova and parasite to see if what you have is a parasite infection. Also blood in the stool if we're looking at a possible ulcer or something else going on. There might be blood in the stool. If all else fails and you're getting mixed information, doctors will then move on to different types of imaging. If it's a gallbladder condition, which is also common in women over the age of 40, we will see some of those symptoms because they have trouble digesting their food, because gallstones can have an effect on, if you have gallstones, it can inhibit bile flow, and that can cause upset stomach and gas and bloating when you're trying to digest your food. So again, that takes a lot of testing. Probably one of the most comprehensive tests I've used is the GI Health Panel, and that does look at things like the bacteria in the stool, along with the candida, and also looks for certain types of parasites. Now, more likely than not, though it may not be the only problem, you're also seeing pancreatic decline in this population. Again, over the age of 40, our ability to produce enzymes to digest our food can sometimes decline, and so I often will prescribe a digestive enzyme. So before I get any labs back, I usually feel that it's safe to prescribe a digestive enzyme. If there's some evidence that the patient has low stomach acid, which can also lead to gas and bloating, or what we call hypochlorhydria, I'll prescribe a digestive enzyme that has hydrochloric acid in it. And that just helps them better digest their food, particularly their proteins. So that's what we call an HCl betaine plus pepsin. Those are the two things that that's the acid and the enzyme that is responsible for breaking down and digesting our proteins. So that is gas and bloating. In terms of, what do I like to help with gas and bloating, my favorite go-to enzyme that I've gotten the best results from is Digest Gold by Enzymatica. I don't work for the company, but I can tell you as a practitioner, that's the first thing I do. Now, if a patient comes back and says, I'm 50% better, but I'm not 100% better, at that point you need to be thinking about labs. Usually, though, I go ahead and I order the labs at the first visit, because I'm not making a diagnosis just based on an intake and a physical exam. I will be running those labs to see if I have to rule out a possible infection or gallbladder disease or something like that. Imaging, as I said before, can sometimes help. People will often ask for imaging. Ultrasounds are often used to check the gallbladder, and endoscopy is sometimes used to determine if a person has a stomach ulcer. That's where we'll go in through the mouth, check to see if there's an ulcer. Sometimes there'll be a biopsy. If there's blood in the stool, colonoscopy is ordered to rule out polyps as a possible cause, along with hemorrhoids. Depending upon the color of the stool, we can determine where the bleed is. If the stool is black, then that would be indicative of blood from a stomach ulcer, and because black stool usually tells the doctor that the blood has been digested higher up in the digestive tract. So that's why black stool is one of the things we look at when we consider a possible upper GI, a bleed in the upper GI, upper gastro intestinal system. But first things first, before you get those labs, before you do all that imaging, try some Digest Gold, because pancreatic function declining as we age is almost always certainly a risk factor as we age. And I always tell people to get their dental care taken care of, chew your food really, really well. Our digestion simply is not as young and happy as it was when we were younger. Number two challenge that I see in my office is heartburn. Heartburn is also what we call acid reflux. That's acid coming in up from the stomach. It can sometimes be worse as we lie down. You lie down and the acid from the stomach comes up. Again, you may go to a doctor that wants to do some imaging to find out what the cause of the acid reflux is. If it's what we call a hiatal hernia, that would be detected on imaging. And sometimes doctors will order laparoscopic surgery to correct a hiatal hernia, where the stomach has pushed up into the diaphragm, and the diaphragm squeezes on the stomach, and that's why you have the acid reflux. It's fairly common. not particularly dangerous if it's addressed. There are manipulation techniques that chiropractors and naturopathic doctors learn where we can go in and through massage we can help sometimes treat or diminish a hiatal hernia depending upon the severity of the hiatal hernia. If you are experiencing symptoms of acid reflux, we definitely talk to our patients about foods that can aggravate, spicy foods, fatty or fried foods. Milk can cause it if you're having trouble digesting milk, coffee, chocolate, those sorts of things. The spicy food would be difficult for me to give up because I love a good curry. But there you have it. Those are the recommendations in terms of foods that we want you to diminish if you have acid reflux. We also tell people to slow down and again chew your food, not eat too quickly. Don't lie down right after eating. Wait a little while until your stomach has properly digested that food. And then after eating your food, what I recommend is DGL, deglycerized licorice. There are a lot of great companies on the market producing deglycerized licorice. Unlike regular licorice, deglycerized licorice will not cause high blood pressure, and it's safe with most medications. Check with your doctor, though, if you are on any medications to make sure that it's safe. So I have them chew 2 deglycerized licorice chews after meals or before meals, depending, and that can help. The other herb that does very well with this population is slippery elm bark. You can get it as a tea, or you can get it as slippery elm bark chews, and those can be chewed both before and after meals, and I get good results with my patients who have that challenge, who have the challenge of heartburn. The third challenge I see a lot of is constipation. Constipation happens again because as we age, the transit time slows down. How quickly we can move food through our digestive tract can decline as we age. And that happens because our digestive tract is getting older, and the smooth muscles that allow for the natural movement of food through our digestive tract, what we call peristalsis, we call that movement peristalsis, that process can slow down the older we get. So we want to encourage healthy peristalsis. The other thing is to increase fiber as we age can sometimes help with peristalsis. So for constipation, I usually will go for fiber and water before I will run to a laxative. Chronic laxative use is not going to take away the underlying challenge, and it's not going to help you with constipation. If you're on a high fiber diet and you're still constipated, there can be a number of reasons why. A small intestinal bowel overgrowth, too much bacteria in the small intestine. Again, it can be partially due to poor pancreatic function. If you're not able to digest your food, it winds up in the small intestine undigested, where bacteria then feed on it, leading to too much bacteria in the small intestine, and that can also cause gas, bloating, upset stomach. But we also see in that population a chronic constipation, but that is worse with fiber. So you want to go to your doctor if she's a naturopath and have her do a test, a breath test, a SIBO breath test, to rule out possible small intestinal bowel overgrowth. But with constipation, again, I don't encourage a chronic laxative use. The other thing you might want to try if you have a problem with constipation and you are eating fairly well is yoga or Pilates mat work, which strengthens your core. Because as I mentioned earlier, the older we get, the weaker the muscles of our digestive system become. And so we found that in patients who do a lot of core exercises, strengthening the abdomen, strengthening the core, whether it's Pilates mat work or yoga that's focused on strengthening the core, that population tends to see a dramatic improvement in their digestion overall. Okay, so those were the 3 top things I see in my perimenopausal, menopausal patients for gas, bloating, heartburn, and constipation. The last thing I would say is that I did not cover a lot gallbladder disease. Gallbladder disease is common, as I mentioned before, in patients over 40. We say fat, fertile, female, flatulent, fertile, 40. I think I mentioned them all. Though if you are fair, pale people, women, those are the people that are likely to have gallbladder disease or gallstones. So again, I didn't focus on that, but if you do have gallstones, you may have many of these symptoms. The other thing I would say last about gallstones is that it's often accompanied by a sharp pain. If you're having that sharp pain, particularly after eating fried foods, that could be an indication of gallstones. Or if your stool, after you've had a bowel movement, if it's floating or appears greasy, that can be a sign of gallstones. All right, that about wraps it up. I hope I got to everything that was on my list, and I want to thank you for watching this video of my channel. And if you like learning about how to stay healthy beyond 40, 50, 60 and above, be sure and share, like, subscribe, and tell me what you're doing to stay healthy as you age. Thanks for watching. Take care. Bye-bye.